Hello, everyone. My name is Melvin Williams, and today I'd like to share how acupuncture and Eastern medicine can help support people recovering from trauma, whether trauma comes from cancer treatment, military service, chronic illness, or major life stress. Many people believe trauma is only psychological. However, trauma often becomes stored in the body, like long after chemotherapy ends, long after deployment is over, and or a long after a major life event has passed. People may continue struggling with anxiety, poor sleep, chronic pain, fatigue, hypervigilance, and emotional exhaustion. Now, as a veteran, cancer survivor, and future doctor of acupuncture, I have seen firsthand how trauma affects every aspect of a person's life. This is why I believe acupuncture has an important role to play within modern healthcare. Today, I will briefly discuss three things: how trauma affects the body, how acupuncture and Eastern medicine can help support recovery, and how future healthcare professionals can integrate acupuncture into trauma informed care. So, how does trauma affect the body? Well, most people think about trauma, they think about emotions, but trauma also affects the nervous system. People experiencing PTSD, cancer related stress, chronic emotional fatigue, or trauma often experience symptoms such as difficulty sleeping, anxiety, depression, chronic pain, digestive issues, fatigue, and difficulty concentrating. In Eastern medicine, we view these symptoms as signs of the body's regulatory symptoms have become disrupted. Instead of asking, what disease does this person have? We also ask, how is that person's body adapting to stress? This broader perspective helps us understand why two people have the same diagnosis may experience completely different symptoms and require different treatment approaches. How acupuncture and Eastern medicine support recovery? Well, let's get into that. Well, it's a little bit like acupuncture is one component of the Eastern medicine uh, toolbox that uses sterile hair thin needles inserted in specific points of the body. Research suggests acupuncture may help regulate the nervous system, improve sleep quality, reduce pain, support emotional well being. For trauma survivors, acupuncture is often also alongside conventional medicine, not as a replacement, but as a complementary therapy. Eastern medicine may also include Chinese herbal medicine, breathing exercises, nutrition recommendations, lifestyle counseling, or ear acupuncture, which is a regular protocol such as NADA. The goal is not simply symptom suppression. The goal is helping patients restore regulation, resilience, and quality of life. Imagine a veteran sleeping through the night for the first time in years. Imagine a cancer survivor finally feeling calm after months of treatment related anxiety. Or imagine a healthcare system that focuses not on the survival, but being true with the people's healing. Now, how can we, as acupuncturists or even healthcare providers, facilitate this change? One of the biggest challenges facing acupuncture in the United States is not the lack of patients, it's the lack of integration. Future acupuncturists can help change this by publishing peer reviewed research, participating in trauma and oncology studies, joining professional organizations, uh, advocating for healthcare policy reform. Politics, though, basically, building collaborative relationships with physicians, nurses, psychologists, and other healthcare providers. Research creates credibility, advocacy creates access, and the collaboration creates the opportunities for patients to receive more comprehensive care. As Dory Clark discusses in Entrepreneur U, professionals who educate and communicate effectively become trusted voices with their industries. That means future acupuncturists must become not only clinicians, but also educators, researchers, advocates, and leaders. So I only got a few minutes with you. So just in closing, I would just want to let you know that this trauma recovery requires more than just helping patients survive. It requires helping them reconnect with their lives. Acupuncture and Eastern medicine offer a patient centered approach that may support emotional health, nervous system regulation, sleep, pain management, and overall well being. My challenge to you and all future healthcare professionals is this: don't wait for acupuncture to be invited into the conversation. Help create the conversation through research, collaboration, education, and advocacy. The future of trauma informed healthcare will belong to those willing to build bridges between medical systems and focus on what matters the most: the patient. Thank you.